Hi there, everyone. Dr. Jess here from Premier Physical Therapy. And today we're going to talk about what should we expect after breast cancer and is pain normal and should I accept that? Let's talk about that. What are some of the common causes for pain after breast cancer? Well, what we're going to discuss today are shoulder pain, myofascial pain syndrome, scar tissue adhesions, and axillary web syndrome. So, getting into shoulder pain first. When there's surgery that's performed around this area, around the shoulder, okay, i.e., breast tissue, could be just mastectomy, lumpectomy, it could be reconstruction, could be a lat flap. There's a lot of different things that are potentially going on in this area surgically. And sometimes muscles don't love that. So you could have muscle related pain after this intervention. But you can also just have periods of immobility because you're recovering when you start to get tightness. So maybe your pecs get kind of tight because you've been sitting for a while and your mid back gets a bit stiff because you haven't been up and moving as much. Well, that starts to impact the shoulder itself because if my mid back isn't able to move like it needs to and my ribs start getting a little bit stiff, then that shoulder blade stops moving like it should. Well, that's important because we have something that's called the scapulohumeral rhythm. So, if I have my shoulder joint and I am moving my arm and trying to elevate, I have to have a couple things that need to take place in order to not have pain. One, I need to have normal firing of the musculature to make sure that I'm doing what I should do, which is drop that humeral head, which gives me the space. See the space that's here? Okay. I need this humeral head to drop because if it doesn't and I start moving and it elevates, then I pinch through here. So then I get what's called impingement. It's like I raise my arm and I'm like, oh, ouch, that hurts. Well, that's because the humeral head's not dropping, and that can be more of a muscle related firing and timing pattern. Well, the other thing that could happen is that as you start raising your arm, if the shoulder blade doesn't move, then as I raise my arm, I start getting that pinch. Okay. So that could be because the scapula or the shoulder blade isn't moving well. And that could, again, just be because of scar tissue. It could be because of some muscle tightness. It could also be just immobility and getting stiff from sitting and recovering for a little while. But all of those different things can really create some pain in that shoulder. And all of that's very treatable. So we can come in, do some testing, get a very specific diagnosis, and make an intervention plan. Other things that can happen, myofascial pain syndrome. What in the world is this? So nearly half, 50% of women within the first year of breast cancer surgery develop this. This is something that we should really talk about. Now, myofascial pain syndrome means that there's a formation of trigger points in muscles that have developed. A trigger point is a palpable knot. So if you're feeling like, if I'm feeling my traps, I'm like, ooh, there's a spot right there. Yowza, that's sore and I can feel it's kind of hard right there. Then that's a palpable knot. What happens if I press that knot? I'm like, oh, ow, I've got pain. It's kind of going up into the back of my head. Why is my head hurting? All I did was press this muscle. Well, that's the referral that happens. So when we press a trigger point, that pain can refer to other areas. Well, that's not good. So now I have pain not only where I have the trigger point, but I also have pain that travels. So myofascial pain syndrome can really cause some significant limitation and discomfort. Okay. The trigger points can be active or latent. An active trigger point means that it's actively referring pain to another location, whereas a latent trigger point, you only feel the referral pain if you disrupt that muscle. So if you start to push on it, okay, or activate that muscle, all right? So common muscles that are affected by myofascial pain syndrome. These are going to be all muscles that are around that shoulder area. So if we talk about the subscapularis, which is the muscle on the front of the shoulder blade, see how it refers to the back of the shoulder and then down the arm into the wrist? It's like, what? And so a lot of times what is truly a muscle related pain or problem can mimic something that feels like it must be much worse. I must have something going on with my neck. I must have a referral pain coming from one of the nerve roots. Well, that could be what's going on. I don't know, but it could also be a trigger point. Another muscle, pec major. Look at that. That's also referring pain down the arm. Same thing with pec minor, referring pain down the arm. All of these are kind of mimicking like, oh, I wonder if there's something going on that's really, really bad. It's just a trigger point. We can treat that, no big deal. Serratus anterior, this one's super common. This one really can create some discomfort in the armpit area and then can also travel down the arm. And then the rhomboids typically don't refer as much. Those are the muscles around the shoulder blade. They stay a little bit more localized to the shoulder blade itself. Now, other thing that can cause pain, okay, scar tissue, for sure. I can tell you, like, I just had a C-section, and I can tell you scar tissue can definitely be not that fun. My scar tissue is in a little bit of a different area than somebody that has scar tissue closer to the breast area. And this scar tissue can be limiting for being able to take maybe a full breath. Maybe it's hard to really contract that diaphragm and inspire. Maybe it's a little bit difficult to really retract and stretch and get you to fire your shoulder blades because you feel this tightness or restriction. It might limit your ability to raise your arm overhead. And it may not. You might not have scar tissue limitation, but if you do and it's restricting your motion, or it's making it difficult for you to, say, tolerate clothing because you've got some hypersensitivity, then this is something that is very treatable, very treatable. All right, last topic, another weird one, okay? It's called axillary web syndrome. Now, this is a funky little one. What can happen sometimes when your lymphatic system is stressed? You may not notice the swelling that's associated with lymphedema, but you might have some fibrosis that happens along some of the lymphatic vessels. Now, what that means is that when you start to raise your arm, those vessels are not going to slide and glide like they're supposed to. And it can create some significant pain in the arm and really limit your range of motion. All right. These are some pictures. So see that in that picture with the cording and the armpit, if you look in the mirror and you raise your arm and you see something like this and then you feel some pain or limitation, then that's most likely axillary web syndrome if you have a history of breast cancer. It can go down as far as the forearm. It typically stops at the elbow, but it does go down as far as the forearm. So these are things that just to look out for, and it's all treatable. Now, options. So let's say that this is going on and you've got pain or limitation and you're like, what in the world could you do to help me? Well, many things. That's what I do. Manual therapy is where I typically would start. So myself or Alicia in the clinic, we're both part of the oncology team and we both are very big with hands-on intervention. So with manual therapy, what we'd be doing is treating hands-on any sort of fascial restrictions, muscle trigger points, joint restrictions, anything that's not moving well, we're going to try and get it moving better. Modalities that we might try. So we might use some fascial tools. So we might do cupping. We might do some dry needling to treat the trigger point, whatever is indicated for that individual. And then we're always going to then follow it up with corrective exercise. So if we do not re-educate the tissue for how to move normally, then you're not going to get the results that you want. We've got to get those muscles to fire and get you moving normally in order to really get some long-term benefit. Now, if you have any questions, any concerns, if something comes up and you're like, hey, Dr. Jess, what do you think about this or that? Please feel free to shoot me an email, okay? You can call the clinic. It's 904-996-6922. And check out our website if there's some more information. Please pass this on to anybody that you think might benefit. And if you've got somebody in your life, it doesn't matter where they live, just educate them that they do not have to continue in this painful state. Let's get somebody to get some eyes on them and try and figure out a plan so that they can get back to living a full and normal life. Okay, so let's just continue to support each other, continue dialogue, and continue to get individuals in this country and other countries informed about what can happen after breast cancer. Okay, all right, see you next week.